Hello, I am Professor Hannah Emma Akwe, also known to many of my students, my mentees, and the children I serve as Dr. Hannah. Welcome to our shared learning space where we think deeply, we practice ethically, and we make complex ideas feel human. Today, we want to explore motivational interviewing, the spirit of it, the philosophy, and change theory. Motivational interviewing is known to be an evidence-based, patient-centered counseling or psychotherapy method designed to help people resolve mixed feelings, or what in motivational interviewing or MI they call ambivalence. Okay, so when people have mixed feelings about change, motivational interviewing is the evidence-based appropriate approach to use. And what this does is it strengthens their internal motivation to adopt healthier behaviors. Motivational interviewing is collaborative, is non-judgmental, is conversational, and is not directive. What it does is it empowers individuals to find their own reasons for change. Let me go through that again. So MI is a collaborative, goal-oriented style of communication with particular attention to the language of change. It's designed to strengthen personal motivation for commitment to a specific goal by eliciting and exploring the person's own reasons for change within an acceptance or within an atmosphere of acceptance and compassion. And this particular statement was is attributed to Miller and Rolnick, 2013. We'll come to know them as we go on. Okay. So who are the founders of this unique way of communicating with people in the therapeutic space? It began in the early 1980s, so it's not as old as maybe psychodynamic or behaviorism. And it was developed by psychologist William R. Miller, this one, and Stephen Rolnick, this one. Uh, I'll keep my comments to myself. This is where I'll go like, I plead the fifth because I don't want to say anything and be incriminated by it. But so what these two gentlemen did was they developed this way of communication to help clients with substance use disorders, particularly alcohol abuse. So Miller is reported to have been very frustrated with the confrontational, authoritarian addiction treatments that increased patient resistance, prompting a shift toward empathetic, client-centered, and non-judgmental conversations that foster a person's internal motivation to change. So he's a professor emeritus, distinguished professor emeritus of psychology and psychiatry, and affiliated with the Center on Alcoholism, Substance Abuse, and Addictions at the University of New Mexico. Okay, he's been there for a while, and he's taught a lot of subjects, including alcoholism, abnormal psychology. He's done seminars on positive psychology, and on self-fulfilling prophecies. Oh, I think I would love him. Yeah, a bit more like what Job said, it's like what I feared has come upon me. I was going to say something about this. I think I lost my track of thoughts. Anyway, does this description of this theory remind you of any other theory? Did you remember Carl Rogers? If you did, I think you should clap for yourself. Anyhow, let's look at Rolnick and see what this says. Rolnick surprisingly grew up in Cape Town in South Africa and completed master's training in research methods in Glasgow and a professional training in clinical psychology in Cardiff. Since then, he has lived and worked there as a clinical psychologist in the National Health Service and more recently as a member of the Department of General Practice. His early experience as a trainee nurse in a hospital addiction treatment setting led to an interest in constructive methods for helping people resolve difficult behavior change problems. So the most current version of MI is described in detail in a book they wrote together in 2013. And that book is called Motivational Interviewing, Helping People Change. And it's in its third edition. So some of the key qualities in MI include that it's a guiding style of communication that sits between following and directing. So for following, they describe that as good listening, and directing, they describe that as giving information and advice. Do not pick any one word out of it to run with that for now. Okay, hold on a bit. We'll walk through everything we need to walk through so you don't get confused. Okay, so we are talking about the key qualities. So MI is designed to empower people to change by drawing out their own meaning, importance, and capacity. MI is based on a respectful and curious way of being with people. And this is supposed to facilitate the natural process of change that honors a client's autonomy. It's important to know that MI requires the clinician to engage with the client as an equal partner and refrain from unsolicited advice. Oh, that's going to be hard for some people, I know. MI is not confrontational. MI doesn't instruct, doesn't warn, doesn't direct. It is not a way to get people to change or a set of techniques to impose on the conversation. MI takes time, practice, and requires you, the therapist, to have a lot of self-awareness and discipline before you even engage with a client. Okay. So according to motivational interviewing, change is hard not because people are lazy or they are in denial or they are resistant, but it's because ambivalence is a normal part of human experience. So I think it was a couple of weeks ago when I was teaching about Carl Rogers, and we're talking about his core principles of empathy, genuineness, and unconditional positive regard. And I think I was reading an article that talked about he had this stance because he realized that just being human is so hard. And so when you come across like that, have that state of heart as a therapist and sit with clients, it makes you respect them in a different way. Because truth be told, how many of us as therapists are comfortable going for therapy ourselves? We like to feel like we know everything, don't we? So you need a certain level of humility to do MI. Okay, so when people consider making a change, they're usually pulled in two directions. So a desire to stay, a desire to change, and a desire to stay in the same position. Hey, let me trigger you a little. So we all come from amazing families, but there are some of us whose families and family dynamics and interactions require that we create some boundaries. If you're a typical African, on the one hand, you feel like, oh God, I'm so evil for wanting boundaries, for saying that they should call me before they come to my house. And then on the other hand, it's like, yeah, I don't want their trouble. Let them just come any day and any time. And then they come and then you are resentful. So what do you do? Another thing is religious beliefs. We are aligned. The interesting thing here is many people want to ask if you love the Lord when it comes to religion. They would ask, what church do you attend? And again, I'm keeping my comments to. So there's this pastor I really love and appreciate. Every time he talks, he goes like, Sila. And that means he's pausing. So this is what I'm also going to do, Sila, I'm pausing. But these are some of the things we do. It's change is hard because we fear losing the norm, even if the norm is not so healthy for us. We have habit patterns that we've grown up with, and it's like, I know it's not good, but I'm used to it. So what do I do? Sometimes in a social context, there are things that we do, or people who probably trigger us in ways that we know this is so not good for my mental well-being, and yet we can't move away from them. And then our own identities. We are so fixated on who we think we are that even if that is harming us, we struggle to change. And so when our clients come in with similar things, just show grace to yourself and show grace to them, and know that being human is hard, and it comes with change, and change is hard too. So when you are using MI, the spirit of MI is that you respect that they are willing to even engage. You respect the fact that you, yes, you, haven't been able to fix everything about yourself. So don't make it look like you're perfect. Okay. All right. So when MI uses a lot of the word ambivalence, when they talk of ambivalence, what do they mean? So is the core reason that change is hard? Is that experience of having mixed feelings or two ways about a behavior? So current behavior of maybe sitting all the time, it's beneficial. I don't get dusty, I don't sweat, but it provides immediate rewards. I'm comfortable. I know my environment. But the new one requires effort and discomfort. And it sacrifices that immediate reward. So I am stuck. What do I do? Especially if, for those of us who always have this idea of, it's a new year, my new year resolution. You've done that whole thing for so long. If you don't get extra help, you won't even have the courage to change. So what's the spirit of MI? There are two implied active ingredients in motivational interviewing: a relational component and a technical component. The spirit of motivational interviewing is concerned with this relational aspect. The spirit of motivational interviewing is collaborative, compassionate, person-centered mindset that a clinician brings to a conversation so that you can help the client resolve ambivalence and find internal motivation for change. So the spirit of MI includes partnership. It is necessary for you to have acceptance of the client. And because you are accepting of the client, you have deep compassion for the client, and you ask a lot of evocative questions coming from a place of respect, because you are not trying to impose solutions or use your authority. Okay. So there's this agency in, I think they are New Zealand. I don't know, Australia or New Zealand. They're called the Hall McMaster and Associates Limited. And they say that the key difference is that motivational interviewing is more focused on goal directed than the non-directive person-centered counseling. Let me say that again. Motivational interviewing is more focused and goal directed than non-directive person-centered counseling like Roger's own. Motivational interviewing has at its central purpose the examination and resolution of ambivalence. So why is the client ambivalent? How do we work together so that they can resolve that? And the key worker is intentionally directing in pursuit of this goal. So motivational interviewing, while it has a learnable set of techniques, is more importantly a style or an approach to assisting clients in resolving ambivalence and changing behavior. Without the underlying spirit of motivational interviewing, there's the huge risk of it becoming a vehicle for client compliance with little long-term change. So what we want to do is, as we come alongside the client, we are anticipating that the change will go on and on and on. And so if you do not use the heart of MI, not the technique, but that stance, the attitude, the approach, then the client won't gain as much growth as we are hoping for. Okay. When we say we are coming alongside the client as a partner, partnership or collaboration means working in partnership with the client, where the therapist is supportive rather than persuasive. Okay, we are not using a confrontative approach. We respect the autonomy of the client. We want the client to take ownership of whatever we are doing together. You are not an expert, and your client is not a passive patient. You come together as equals. Now, when MI practitioners talk about acceptance, it's very Rogerian, and in the context of motivational interviewing, it's divided into 4 key points. There's absolute worth, there's autonomy and support, there's affirmation, and there's accurate empathy. Okay, so when we talk of respect and autonomy and support, we mean that the responsibility for change is left with the client. This means that the therapist demonstrates respect for the client, for their resourcefulness and their ability to make change. And as we go into the other videos, we'll probably have a few practice sessions for you to know what we mean by these things. And because you are respecting their autonomy, we are not pushing them for any immediate commitment. When you are bound to push a client, just ask yourself, if it was me, how would I do it? And be honest. All right. Acceptance also means non-judgmental. So you do not have the right to sit and, even if you don't open your mouth, say it in your head. It's like, how could they have made such choices to get to this point? Remember, life is hard. And then when you have accurate empathy, you actually respect them. It's the core skill of MI. It involves much more than simply repeating back what somebody says. In accurate empathy, you convey to the client that you're really trying to understand what's going on with them and what this problem means to them. Okay, so we are talking through a few of the terminologies. The next one I want to talk about is compassion. So compassion means that as the helper, we are trying to work with the client, again, in a non-judgmental, non-blaming, non-shaming way. We are trying to understand what this problem is like for the client and what it means to them. Okay, so what we want to do is we want to actively promote their well-being and prioritize their needs. Otherwise, hey, why are you there? So in order to feel compassion for someone, we must understand their point of view and experience, at least to some degree. However, compassion alone without sustained empathic understanding can be very counter-therapeutic. So, as helpers, we can, at times we believe we are being empathetic because we feel compassion for clients. But if we misunderstand the complexity of their experience, it messes up with the whole compassion thing. So I would suggest that if you are using MI, do it under supervision for a long time before, because it's so easy for us to think, oh, I was going left, not knowing that you were actually going right. So compassion is really, really important. And then I use an expression, evocation. This means to draw out of the client their own perceptions, goals, and values. And this is where your use of reflection of content is very, very important. But if you don't listen well, you won't be able to even reflect. Okay, so the helper starts with the assumption that resources and motivation for change reside in the client. In practice, this means that you elicit from the client rather than imparting information. Again, a lot of listening. You listen. As you listen, you are listening not just with your ears, but with your heart. And that's a statement I use a lot in healing play. When we are working with children, we want them to listen with their ears, watch with their eyes, and listen with their hearts. And I think that's something we as adults also need when we are doing motivational interviewing. Now, in motivational interviewing, change talk represents the client's statement favoring, desiring, or planning for behavior change, and this signals readiness. Sustained talk consists of statements that support the status quo. So justifying why I should keep the current behavior. The goal of MI is to reduce sustained talk and increase chain talk. Let's do a little bit of. So the focus of chain talk is to move towards a new behavior. The focus of sustained talk is to stay in the current behavior. The goal of chain talk is to highlight benefits of changing. Sustained talk just rationalizes the current behavior. The intent of chain talk is to express the desire, ability, reason, need. And the intent on sustained talk is just to say, oh God, I'm afraid. Also, all the things that make the current situation beneficial. And at the end of the day, we want change talk to help predict better treatment. Well, the outcome when we are doing change talk, it predicts better treatment. And then sustained talk just, if there's going to be any change, it's very slow or sometimes none at all. So in using MI, we are hoping that we can enhance change talk and not sustain talk. Okay. All right. So some professionals have come up with an acronym DARN CAT as identifying change talk. And the D is desire. I want to. So when you are talking with the client and it sounds like the client is consistently using things like I want to, or when they have the ability, they'll say, I can. Then you tap on that and you use that as, oh, I can see that you are desirous of this. Okay. And they should have a reason, which I should. There's going to be, you have to identify a need. I have to. And then the commitment, I will. Then you know that you're almost there. Activation, I am ready to. And then taking steps, I started to. So DARN CAT, DARNCAT. So the more a person talks about the benefits of changing, the more likely they are actually to make that change. Have you noticed clients resist when told what to do? What am I talking about? When you tell a child, sit here, what's the thing they will do? They will get up. So if children with no experience are doing that, how much more adult clients? Okay, so when you advise, there's resistance. But within MI, when you use the MI skills well, there's collaboration. Now, what about our African context? So the African context significantly impacts motivational interviewing. Remember, motivational interviewing is client-centered, focused on individual autonomy by requiring adaptations for a deeply communal, hierarchical, and resource-constrained environment. But in the African setting, MI is often most effective when it shifts from a strictly individualistic, person-centered model to a family or community-centered approach. Okay, so MI decisions regarding health, so treatment, adherence, lifestyle change, are frequently made by family members or elders or spouses, which means that as a therapist, you need to include key family members if you want a client who is very family focused to thrive and to heal. Some also are connected, have a high connection with community identity. So there's a lot of interdependence over independence. That whole thing of I am because we are. That emphasis on identity as relationship with others, which means that personal goals are often inseparable from community or family goals. And so when you're using MI, when you are dealing with typical African contexts, remember when I say that, it doesn't mean in Africa, because there are people in Africa who are very European minded, and there are people in Europe who are very African minded. So you have to understand where your client is coming from so you can help as much as possible. Okay. MI, when adapted to be culturally grounded, acknowledges community norms, and it can be very effective because it aligns with shared values. And when we are thinking of it as a respectful communication style, it comes in. Listen, when you are respectful, you can't get it wrong anywhere. And that whole perception that people have of, oh, when you are respectful, people will take advantage of you. I don't really believe that. I don't. You respect a client's culture, a client's value, they get to listen to you when you do that. Okay. A lot of Africans also have spirituality and or faith um very tightly connected with their worldview and everything they do. So just remember that when you're using AI with clients who have an African or family mindset, because they are generally bound to have faith. And so the interesting thing is faith and spirituality play a crucial role in daily life and health behaviors. So it's important that you incorporate that in a way that makes a family recognize that you're respecting them. And due to high patient loads, limited staff, and inadequate supervision, full protocol MI is rarely feasible. Instead, MI-informed counseling, so including brief targeted sessions, is more common. So look at what you have available and then make sure that that works in a way that's consistent with your style. Okay. All right, let's see. Case example. Do you have your pen and paper with you? You should. So Akpene is a 40-year-old professional banker, and she's been going out with Akwesi, who is 35 and a lecturer. Akpene is struggling with trusting Akwesi, especially as they start talking about going to meet the family for discussions towards marriage. Now, as a therapist using MI, and you are helping Akpene process her ambivalence, the first thing you need to do is normalize and validate the mistrust. So clients with relationship distrust are often told they are being too suspicious. Oh, just move on. What MI does is it reverses this by validating their feelings as protective measure. Okay. So reflective listening to acknowledge their fears. Something like, it sounds like protecting yourself from being hurt again is very important to you right now. So you are being cautious for a good reason. When we do that, it's bound to reduce defensiveness and build trust, which is very essential before we can even describe change. The next thing in working with Akpene will be to use a decisional balance tool, that is exploring. So you map out the pros and cons of the current situation. Okay. So what I have feared, pros and cons. What are all the pros of going out, going further on with Akwesi, with a marriage? What are all the cons? And then you process that. So what does keeping your guard up do for you, or what does going ahead do for you? And then what are some of the less good things about staying in and moving ahead with the marriage? So explore the potential future. So if you keep going down this path, what do you see happening maybe in 5 years? And allow her to talk. The third one is evoking. You elicit and amplify chain talk. So gently guide her to express her own reasons for the distrust using the DAN framework: desire, ability, reasons, need, and then the CAT. Okay, so how would you like things to be different? What are the best reasons for you to take a risk and trust? How does your current level fit with your long-term goal? If you did decide to go ahead, how could you do it? And then sometimes you can soften the sustained talk by using a double-sided reflection. So, for example, if she says something like, I can never trust again, you can use yes, but formula to reflect both sides. So people will say you are playing the devil's advocate. So, for example, on the one hand, you feel it's essential to protect yourself. And then on the other hand, you are tired of this constant tension and you just don't want to try it again. And then I think the last but one would be to develop discrepancy. So highlight the inconsistencies. Help Apprentice see the gap between their mistrust and their values. Okay. So, for example, you've mentioned that having a secure relationship, loving partnership is one of your core values. And I'm also hearing that you can't trust him. That seems like a really tough spot to be in. You don't have to tie it in a bow. Just leave it like that. Sometimes it helps for clients to have that reflection and helps them to think deeply. It may or may not happen in session, but they will go and keep thinking. Okay. And the final one we want to do is to empower the client. So we support autonomy. Reiterate that the choice to trust is entirely theirs. No one can tell you when or if you should. Remember, you are not going to give them advice. You are just guiding them or supporting them to make their choice. So I'm going to put an activity in a link there. Let's see if you can identify the change talk. Let me see if I have what it takes to give you a little bit of narrative and see if you can answer those. So a client comes and says, I know smoking is bad, but it helps me to calm down. My children complain about it. I want to stop, but it's difficult. Which part of the client's narrative is change talk? And which one is sustain talk? All right. I think that should be it for now. So if you are not taking anything at all with you, just remember that MI includes the spirit of MI plus the skills. Ambivalence is normal. In therapy, you have to evoke change and respect the client's autonomy. So what next? You need to take the quiz in the YouTube link and get ready for the next lecture on core MI skills. And that is where we'll be talking about the ORs. Okay. Until next time, stay curious, stay ethical, and care well.